For years, we here at the Illinois Chiropractic Society have been talking about the importance of the Medicare program. And not just the importance in regards to those who have Medicare coverage, but for the program's influence on the private healthcare insurance marketplace. Medicare is critical. Our leadership team here at the ICS has taken a hardcore stance and said, anything that we can do as a state association to influence proper inclusion for chiropractic services in the Medicare program, that becomes a priority for us. And we have done that. We have lobbied in Washington, D.C. and also in district. The good news is this. A few weeks ago, legislation was introduced. It was bipartisan legislation introduced by Congressman Higgins and Reed out of New York. And that legislation really seeks to bring parity in the Medicare program for chiropractic services. The first thing it does is it enables chiropractic physicians to be considered physicians under the Medicare program. Additionally, then, it allows chiropractic patients to receive coverage for those Medicare covered services that fall within your state scope. So if it's within your state scope here in Illinois and it is already covered under Medicare, then those services would be reimbursed under this legislation. Now, the other thing it does is it puts some responsibility on us. And one of the challenges that we have been faced with is documentation. So it does require that chiropractic physicians take a documentation webinar specific to the Medicare program. And that is a big, important part of this program. And if you don't take that particular course, then your reimbursement procedures would really remain the same. What is reimbursed today is what would be reimbursed then. However, going through that education, once this passes, then chiropractic physicians would have full inclusion in the Medicare program, both as physicians and for services rendered. We're really excited about this bill. It is House Resolution 3654. And again, it was introduced by Congressman Higgins and Reed. And here is what we are asking you to do. We want you to take action today. Just heard that, as of yesterday, there were about 4,000 submissions across the United States. And quite candidly, we have 4,000 licensed chiropractic physicians right here in Illinois. And we would like to see every last one of you take action on this very important legislation. So we try to make this as easy as possible for you. If you just jump out to www.ilchiro.org/3654. So that's ilchiro.org/3654. It'll take you right over to the Action Center with pre-crafted email possibilities for you, and it won't take long, I promise. In fact, our leadership team, we've already called to action. They're already stepping up. As a matter of fact, they're home, so they're back in district. If you have a relationship, or even if you don't, call and schedule a meeting with your congressperson. You can jump out to the same website I just gave you, and they've got talking points that you can utilize. They equip you with issue briefs and other information that will enable you to have those intelligent conversations with your congresspersons when they're back in district, which is right now. As a matter of fact, next week I am meeting with my congressman down here in the middle of the state, Congressman Rodney Davis, and we're going to sit down and talk about House Resolution 3654 and its importance, beyond just the importance for the chiropractic profession, but the importance to your patient, the importance to the opioid crisis that we're faced with, not just in Illinois but nationwide. So we're really excited about the possibilities of this bill advancing. We need your help, and we're asking you to take action again right now. It's as simple as this: ilchiro.org/3654. It'll take you right over to the Action Center. Take action now. We'll catch you next week.